Included in the Canine oral surgery pack are the 3 winged elevators in different sizes, 2 millimeters, 3 millimeters, and 4 millimeters wide at their cutting tip. These instruments are shorter than the standard length to fit both smaller and larger size hands of the operator. The bulb handle is bigger in diameter, provide more comfort and to provide more power to the operator. The bulbed portion of the handle should fit into the palm of the hand and be grasped firmly with the fingers, using the forefinger to come up and act as control for the cutting blade. In this aspect, we have the instrument. The bulb is in the palm of the hand, and the palm is in line with the wrist, which is in line with the forearm. That permits more power to penetrate, as well as an ease of oscillating in one axis to provide even deeper and deeper and deeper penetration into the periodontal ligament space. When the instrument is within the periodontal ligament space, then the instrument is twisted and held to fatigue and break down the periodontal ligament fibers. The number 4 winged elevator, the bulb fits in the palm of the hand, grasped firmly, and then I use the finger to act as control over this instrument. I'm taking this instrument, going between the root and the bone, making sure I get into the periodontal ligament space. I'm pushing in as I oscillate back and forth to go deeper and deeper between the root and the bone. When I can go no further, I'm going to apply twist and hold to stretch and fatigue the periodontal ligament fibers. I need to hold this for 30, 40, and sometimes even 50 or 60 seconds. And then I oscillate even deeper, going deeper down between the root and the bone, applying more twist and hold. And then I will go even deeper between the root and the bone, as far down as I can go toward the apex of the tooth, and continue to apply that twist and hold. When I've made some space on the mesial aspect of the tooth, I'll then go to the distal aspect of the tooth, working down between the root and the bone, pushing in as I oscillate back and forth. And when I get between the root and the bone, I can apply twist and hold more. And then I will go even deeper in, pushing in, twist and continue to hold. And then I'll go even deeper down in, twist and hold. I'll go around the entire circumference of the tooth, including the palatal aspect of the tooth, all the way around until I can get the tooth nice and loose. And when the tooth is loose, then I can use the Extremel extraction forceps, grabbing onto this tooth with a nice firm grip, and apply twist back and forth here, and I can then remove the tooth. After the bone removal with a good high-speed drill, now I'm going to use the number 4 winged elevator with the bulb held in the palm of my hand, grasped firmly with my finger close to the cutting blade. This blade has been freshly sharpened, and now I can insert the instrument between the root and the bone, pushing in, oscillating as I go to get this elevator as far down between the root and the bone as I can get it, and then beginning by applying some gentle, steady twisting and holding to the root. I'll twist and hold for at least 40 to 50 seconds. However, when I get movement, then I can advance it even further down between the root and the bone, oscillating and pushing in and continuing to apply that twist and hold. Now that I've got movement, I can apply even more pressure in, twisting and holding, and allowing this periodontal ligament fibers to stretch, to fatigue, and also to be severed by the sharp end of the winged elevator. Once we've worked on the mesial aspect of the tooth, we can withdraw the instrument and go to the opposite circumference down the distal aspect of this tooth. I'm working my elevator deeper and deeper down toward the apex, cutting periodontal ligament fibers, applying twist and hold, allowing the periodontal ligament fibers to fatigue and driving the elevator even deeper down in between the root and the bone. Continuing the drive toward the apex of the tooth, going around the entire circumference of this tooth and waiting until the root gets looser and looser and looser. One of the things that may be necessary as we get toward the apex of the tooth is to switch size from the bigger number 4 to the smaller number 3. With the smaller number 3, I can get deeper down in between the root and the bone toward the apex, helping me to further sever periodontal ligament fibers to further loosen this root. Doing this on the mesial aspect of the tooth, also doing this on the distal aspect of the tooth as well. And when the tooth has become very loose, then we can grab on with the extraction forceps. These are the Extremel extraction forceps. I'm using these forceps to grab onto the canine crown here with a great grip using the serrated jaws, and I'm rocking this back and forth. And with just a little bit of movement, then we can withdraw the root. Nice rounded root end and a nice solid tooth.